Hello, my name is Christine Edmonds. I am an RN clinical instructor for Cayuga Onondaga BOCES LPN program, who found that it was important to implement a change during the 8 a.m. med pass due to the length of time and delayed care that was being provided to the residents from the students on the clinical rotation. This project was implemented into an LPN nursing program's clinical rotation on a long-term care unit in order to prevent patient harm and increase the efficiency in medication administration. Prior to implementing a change to decrease interruptions during medication administration, the majority of residents on the unit were not receiving medications within 1 hour of their scheduled time, and the 8 a.m. med pass was not done until almost noon most clinical days. Due to this, residents were put at increased harm for not receiving medications on time, including insulins and critical heart medications. This project promotes nursing leadership at the bedside by identifying an area which increases patient harm and implementing an evidence-based change to improve the quality of care being provided by student practical nurses during clinical, along with bringing awareness to the facility's unit nurses and directors of nursing and education. Collaborators for this project included myself, Christina Edmonds, who is the clinical instructor who implemented the change, recorded results, and kept all team members engaged throughout the program's entirety. Student practical nurses Morgan Melchior, Laura Maurer, Mackenzie Wise, and Rebecca St. Martin, who collaborated by wearing the lanyards, hanging the Do Not Disturb sign, and offering feedback on how they felt the change was going. The director of the nursing program, Andrea Ruff, MSRN, who was engaged in the project and assisted with offering feedback and guidance in regards to initiating the program and how to display results. The director of nursing at Loretto, Jolene Crehan, RN. The director of education, Teresa Mosier, RN. The unit manager, Melissa Lambertson, RN. Unit LPNs, Sabrina Bellato and Casey Woodman, all collaborated on the project by giving approval to implementing the change, along with offering feedback and guidance on the change and the best way to display results. The specific aim of the project is, by May 3, 2019, 100% of scheduled medications will be administered by the student practical nurses to the residents on the Loretto 7th floor long-term care unit within 1 hour of the scheduled time in an effort to prevent patient harm and improve patient satisfaction. In order to reach this aim, research was done and it was found by Cooper, Tupper, and Holm in 2016 that a large number of disruptions during medication administration is linked to decreased efficiency and lengthened medication administration times. We implemented an evidence-based practice studied by Del Agliago et al. And created a medication error reduction zone at the medication station and implemented the use of a Do Not Disturb lanyards to signal when medications were being prepped and administered in order to decrease the number of interruptions based on evidence-based practice suggested by Westbrook, Lee Hooper, Middleton, and Lembaum in 2016. During this project, we conducted 3 PDSA cycles. After obtaining baseline data of how many residents received their medications within 1 hour of the scheduled time and what time we finished administering medications at the 8 a.m. med pass, we started the first cycle, which was implementing the use of medication error reduction zone sign to signal to not disturb the instructor and students during the med pass. First, we collaborated as a team to best identify how to display the information and created the sign. After the planning, we hung the sign during the clinical days while my medication administration was taking place, and I recorded the number of residents who received their medications within the 1 hour window and the end time for the med pass that morning. After each clinical day, we would meet as a team to discuss how the day went, what distractions were encountered, and the feedback of the sign. After 3 clinical days, we determined that interruptions were still being made and the results weren't demonstrating a progress towards the aim, and decided to further research and plan to implement the use of wearing an indicator that med preparation administration was being done, and during planning decided that we would make our own sashes based on Westbrook, Lee, Hooper, Middleton, and Lembaum's evidence and created lanyards. During clinical, the sign was hung and lanyards were worn. Results were recorded each day on how many residents received their medication within 1 hour and the end time of medication administration. After each clinical day, the team would get together, talk about distractions that were encountered, the barriers to the study, and found that the results still weren't progressing towards the aim. After discussing as a team, we found that the unit staff and some student practical nurses did not fully understand the project's purpose and importance of decreasing interruptions during medication administration and plan to educate the oncoming clinical groups and unit staff more in depth on the aim of the study. After providing education, we continue to wear the lanyards, hang the sign, and record the results from the clinical days. Upon studying results and illustrating in 2 separate run charts, it was determined that a positive trend in progress was made towards the end of the study, but the aim would not be reached by the end of the project. Barriers that were encountered during this project were that there were rotating clinical groups with new students every 4 clinical days. Students lacked of experience on the unit with medication administration and other skills. Limited amount of clinical dates, not having the correct medications in stock, unavoidable distractions from residents, not being able to administer medications during their mealtime, which falls during the morning medication pass, and lanyards breaking during the medication pass. Things that facilitated the project were the positive feedback, enthusiasm, support from the director of the program, director of nursing, the unit staff, and the student practical nurses. The change implemented during this clinical rotation has brought awareness to the facility and nursing program on the amount of interruptions encountered during medication administration. The change did not meet the aim of the study, however, did demonstrate improvement following 3 PDSA cycles, which was measured through the number of residents who received their medications within 1 hour of the scheduled time and the end time for the 8 a.m. medication pass, which is displayed on the 2 run charts. More research would need to be done to identify if this would be beneficial to licensed practical nurses regularly practicing on the unit and its impact on preventing medication errors. However, it is recommended that all clinical groups and long-term care units implement this change due to the large number of disruptions encountered during medication administration and the positive results that were identified from this study.